Thank you, TJ. I was going to start by saying, wasn't Dr. Wasson just fantastic last night?
Yeah.
I think the whole country needs to hear what he had to say, so that was just awesome. We're trying something new, at least for me. This is my daughter Jamie, and she is videotaping this presentation. We're going to try to put it on Facebook, so we'll see how that turns out. But it's a new experience for her and for me. By the way, Jamie works for the Rapid City Tribune, so if you Rapid City chiropractors need to buy an ad, there she is right there.
Woohoo!
Come on, that gives her an applause. How many of you heard this presentation or some of this presentation either in Pierre at the legislative reception, that was a 2-hour presentation, or the one in Deadwood, that was a 4-hour presentation? Raise your hands if you've heard of that. Okay, so quite a few. This was originally intended to be a 1-hour session. We've extended it to 2, so that means I can talk a little slower, which is really good. So anyway, this is called the Neurophysiology of Vertebral Subluxation. Let's go to the next slide. So what started this journey? How many of you remember when Dr. Chestnut spoke to us in Deadwood 4 years ago? And how he asked us questions about research, and we really did pretty bad at answering those, and he got downright angry with us. And so I did go home from that conference, and I started reading research papers, and that ultimately led to the preparation of this presentation. Well, then in 2017, Dr. Seaman talked to us in Deadwood also, and he said essentially the same thing. You've got to know your joint physiology. And you've got to be able to explain it in a scientific manner. Well, then Dr. Horvik spoke to us in Sioux Falls and really said the same thing. You've got to arm yourself with evidence. That's why I'm here, to help arm you with some evidence to show you why the chiropractic adjustment works so well and how chiropractic works. When you talk about something like the nervous system, you just realize the more you learn, the more you realize you don't know. I am not a chiropractic neurologist. There's at least one advantage to that is you're going to get mainly the practical stuff. Okay, so before we begin, I really would like you at the top of your notes. By the way, does anybody have the notes? They were online. So I would encourage you when you go home to print those off, because every slide I have has a reference at the bottom, so that, when I tell you that chronic subluxation causes brain cell death, that you have every reference you need to very comfortably, confidently explain that yourself, whether you write about an article about that or in a newsletter. So I would run those notes off for you. They're kind of a reference. They're not just slides, they're written out, so it's almost like a document. But right now,
Marvin, I'll pass mine around for people to look at,
okay,
so they know what they could get.
All right, he's going to pass those around so you know what the notes look like. So whatever you're writing on right now, I'm going to ask you, write down a number from 0 to 10, how serious you would rate an upper cervical subluxation. And then at the end of the presentation, I'm going to ask the same question, and hopefully we see some improvement in that. Here's my outline, and I'm not going to read through that right now, except the first one I'm going to read through, because we'll go through each one of these as we cover them. I feel like this thing fell off here. There we go. Okay, so the first point is subluxation decreases mechanoreception and increases nociception. For everybody right now today, how many for you is that just common knowledge? Raise your hand. I'm surprised it's not higher, but I'll tell you what, 4 years ago, when Dr. Chestnut talked to us, at least to me, that was brand new information. Now I know that information has been out there, but I didn't get it for some reason. And I think any of us chiropractors who have been in practice 20 years, 25 years, we probably didn't get this stuff in college. For you new chiropractors, you probably did get it in college. But for us older docs, that's kind of new information. All right, so here's something that I talked about in each of the previous presentations that I'm going to encourage every doctor in this room, every doctor in this state to take this home and promote it in your practice. That the better your spine works, the better your brain works. And the better your brain works, obviously, the better your entire body works. And that's what current research proves, and that's what I want to show you today. Whether you do that, I mean, we had an office meeting a couple weeks ago, and I asked my staff, what do you think the perception is of the public of what we do? Now, hopefully this isn't my staff's perception, but the public's perception of what they think the public's perception was. And it was, well, I think they're your backache treaters. And another one goes, yeah, temporary backache treaters. Does that, stink or what? And then another one said, well, are your stiff neck treaters? What research proves is that we do way, way more than that. And don't you think it's time that we really start promoting what we really do? And again, that's what I encourage you. Go home and promote this simple paragraph. The better the spine works, the better your brain works. And the better your brain works, the better your entire body works. Patients can get that. It's a simple concept. And if we all did it statewide, I think we could change that public perception better than what it is right now. All right, let's begin. Every part of your body is loaded with these receptors. Every part of your body. And they collect information of every kind, and they carry it to your nerve system via your afferent nerve system to the tune of about 3 trillion messages a second. Now, just hearing that number, big deal, 3 trillion a second. But I want to show you just what a vast, colossal number that really is. If you look at this slide, way down in the bottom left-hand corner, there's a little guy here. He's 6 foot tall. And these are stacks of $100 bills. So think about that. If this was going to be 1 trillion messages, there would have to be 99 more piles like this. And then if it's 3 trillion bits of information, there's got to be 2 more piles like that. It's just an incomprehensible number, isn't it? And in my 4-hour session, I spent a whole hour talking about, is that possible? Is that even plausible? And where all these 3 trillion messages come from? And I concluded, and hopefully everybody did with me, that yes, it is a plausible number. Now here's something very, very important to us as chiropractors. The vast majority of these receptors are non-constant. In other words, they are not sending information to the brain continually. And we're going to find out here, the brain has to have constant stimulation to survive. Now, a very obvious example of receptors that aren't constant would be the receptors in your eyes when you're sleeping. They're virtually not firing. One major exception to this are the receptors in and around your spinal column and your rib cage. They fire constantly, even when you are sleeping. Now, when I first read it from Dr. Randy Beck's textbook, I use a lot of his references. But here is from him. He says, examples of constant stimulus pathways include receptors that detect the effects of gravity or constant motion. I want to talk to you about that a little bit, because as I said, when I first read this, I didn't buy into it. I thought, well, how come the receptors in the spinal cord, the spinal column, and the rib cage are constant? Well, because those receptors, they're detecting gravity. When does gravity stop pushing down on you? Does it stop pushing down on you when you're sleeping?
No.
Okay? So constantly. And also then the receptors, they detect motion. Well, now if you're asleep in bed, not moving, is there some part of you that is still moving? Your rib cage when you're breathing. So that's one of the reasons, a couple of the reasons why those receptors fire constantly to the brain. And as I said, the brain has to have that constant stimulation to survive and thrive. And my question is, what profession has the greatest positive influence on this axial mechanoreception? Obviously us as chiropractors. Here's a reference for you from Dr. Chestnut. It says that the adjustment and subsequent increased joint motion stimulates the neuroplastic phenomena of synaptogenesis, which is the creation of new synapses, new pathways, and builds pathways for delivery of the most important brain nutrient for human health and homeostasis ever identified, mechanoreception. You're going to find in this presentation I do quite a bit of repetition. The reason I do that is I want you to have every reference you need. If you do a lecture, if you talk to somebody, if you write a newsletter, that you can reference it, and so that what I am saying is above reproach. I'm going to skip that one. You're going to find this one very, very interesting. I think you heard it yesterday, that Roger Sperry, he is credited with these quotes. One of these quotes is 90% of the stimulation and nutrition to the brain is generated by movement of the spine. It's a fantastic quote. Do not use it. It is unsubstantiated. I'm telling you, I talked to Roger Sperry's associates and friends, Matt McCoy. This cannot be found. So don't use it in your newsletter and all that. I happen to believe the statement is true, that 90% of the stimulation and nutrition to the brain, I'm going to change it a little bit, is generated by the receptors in and around the spine. So not just movement, but alignment and also gravity. But haven't been able to find a reference that really says that just like that. Chestnut comes close. Okay, here's Beck continuing on. He says there are other constant stimulus pathways. And if you look at these, most of they're active in the brain because they are receiving the input from these spinal receptors, like from the vestibulocerebellar system, and maybe not cardiac pacemaker cells, but certain thalamic neurons, certain neurons of the basal ganglia. They're all receiving input from these spinal receptors. Now here's very important to us. All other receptor systems are non-constant in nature, which means they are activated in bursts of activity that are not constantly maintained. This is extremely important to us as chiropractors because the brain has to have this stimulation to survive and thrive. Has to have constant stimulation. Most of you, I bet, by a show of hands, anybody remember the original Hawaii Five-O pilot movie? Yeah, very few. Most of you are probably too young. Anyway, it starred Jack Lord, who was a South Dakotan. He played Steve McGarrett, and he was captured by this Chinese spy, Wo Fat. And they put him in this sensory deprivation chamber called the cocoon, and they tried to shut off all sensory input. It's impossible to shut it all off, but a great deal that they shut off. Anyway, McGarrett was, he was a tough guy, and he lasted longer than anybody else, but eventually he cracked. And he spilled his guts. Well, what they had done, of course, in the movie, they had force hypnotized McGarrett so it didn't destroy his brain when he did that. But anyway, they still use these sensory deprivation chambers for interrogation. And from what I've read about them, they work very well. Within, I should say very cruelly or whatever. Within like 2 days, these people are just having horrendous hallucinations. So it's an effective technique. Here's your reference for that, a reference that the brain needs constant stimulation. Both Guyton and Nolte indicated that if afferent signals are eliminated, and again, there's no way you can cut them all off, but you can certainly drastically cut down on them. The cerebrum would be incapable of functioning in a conscious manner and would actually approach a permanent state of coma. Did I not? I'm sorry, I didn't switch the slide. There's the slide I've been talking about. There's McGarrett and Wolfat. There's some of your references. Okay, so here's a new term, and this is from Beck, the central integrative state. Central integrative state really means its function. It's functioning in a normal manner. But the central integrative state of a neuron or neuron system is modulated by 3 basic fundamental activities. And you're going to kind of pound these into your head. But number 1 is adequate and appropriate stimulation in the form of neurologic communication. So again, the brain needs these three things for the individual brain cell to function, groups of brain cells, and we're going to get to another reference where each hemisphere of the brain needs these three things. Number two, it needs adequate nutritional supply. And number three, adequate gaseous exchange. Carbon or oxygen in, carbon dioxide out. Beck goes on to say, this can be loosely extrapolated or concluded to a functional group of neurons, so different areas of the brain. And then, another reference, different area of the book. By the way, this is from Randy Beck's textbook, Functional Neurology for Practitioners of Manual Medicine. Very, very good, used a lot of reference from there. But now he goes on to say that the level of each hemisphere, how it functions, is dependent to a large extent by the afferent stimulation it receives from the periphery, as well as nutrient supply and oxygen supply. Beck writes this way. I mean, you read that top paragraph and it's like, what? But he says, all multimodal integrated neuronal systems. Wouldn't it be nice if he said the brain, but anyway, needs to receive input from a constant stimulus pathway as well as appropriate oxygen and nutrient supply in order to maintain a healthy central integrative state. So here's a reference for you again. The brain has got to have constant stimulation to survive and thrive. Here's my summation of it. Your brain must receive constant neurological stimulation, plentiful oxygen, and quality nutrition to survive and thrive. What is one major constant stimulus pathway?
Spine. Yeah.
The receptors in around the spinal column and the rib cage. Okay, this slide looks very long, very busy, a lot of words. It's absolutely essential that you understand it. Because in a minute, I'm going to make the statement that chronic subluxation causes brain cells to die. And for you to accept that, for you to understand that, for you to be able to explain it, you need to understand this slide. This is also from Beck. But he says that the types and amounts of protein present in the neuron at any given moments are determined by, here's those three things again, oxygen, nutrients, and amount and type of stimulation it has most recently received. In situations where the neuron has not had adequate supplies of oxygen, nutrients, or stimulus, the manufacturing of protein is downregulated. It goes down, it decreases. This process of degeneration of function is referred to as, here's a new word, transneural degeneration. We're going to look at a definition of that in the next slide. If the brain cell does not produce, or nerve cell, does not produce enough protein, the cell cannot perform the necessary functions to the extent required for optimal performance and or to sustain its very life. So, summary, if the brain cell doesn't get these three things, protein production goes down, and cell function goes down, and if it goes low enough, the cell dies. Here's Wikipedia's definition of transneural degeneration, is the death of neurons resulting in the disruption of input from or output to other nearby neurons. So all of this stuff is in your notes if you run them off and with the references and stuff. It kind of reads just like a neurology textbook. So when a neuron is exposed to a decrease in synaptic activity over a long period of time, and here's my little added note, as with a chronic subluxation, it may undergo a change in central integrative state that results in transneuron degeneration, or brain cell death. I want to make a comment here. Notice how Beck said that it may undergo a change. Have you noticed if you read any of Horvick's writings, and I'll give you some examples here, or also from Chestnut, they all do this. It may, it might, it could. And asked Dr. Horvick that, and she said, well, we just want to be above reproach, so that everything we say cannot be questioned. So, and they use words like it may, and I'll emphasize those when we come to those from these different authors. So here's Beck's definition of transneural degeneration. refers to a state of instability of the nerve cell as a result of changes in frequency of firing and or fuel delivery to the cell. It also represents a state of decline that will proceed to cell death if fuel delivery, activation, and frequency of firing are not restored.
Could we pause and get everybody adjusted right now?
Yeah. So my comment is chronic subluxations deprive the brain of stimulation. Now here's another big word, diachesis, from Beck also, is a law of neurophysiology that states when there are two areas of the nerve system that are anatomically separate, like the brain and spine, but functionally connected, and the upstream area decreases its input, the subluxated spine. That, when I read that, that sounds backwards because we think, the brain is up here. But we're talking about afferent flow, so it's going from the spine to the brain. So the spine, the subluxated spine, is actually the downstream system. And it decreases its input. What's one thing that makes the spine decrease its input to the brain? Come on.
Subluxation.
All right, subluxation. The downstream area, the brain, will drop in its function due to the decrease in input. So that's a law of neurophysiology right there. And now here Dr. Silver, he explains that his kind of a summation of that. When the spine is subluxated, the brain starts to dampen because it's not getting the normal, appropriate input from the spine. Dr. Silver goes on to say, as these nuclei, as these areas of brain drop in their central integrative state, in their function, they fall into transneural degeneration. And what is transneural degeneration? Brain cell death. Here's a quote from Silver that you need to really get. Subluxation through diegetic changes causes transneural degeneration in the brain. So I'd encourage you just to, that's just an amazing quote, amazing summary. Subluxation through diegetic changes causes transneural degeneration of the brain cell death. Okay, so in my outline, when you get the notes, here's point number 5. Chronic subluxations cause brain cell death. And I'm just going to explain it a little further with some of, all of these references from Beck are from different areas of the textbook. But diachesis refers to the process of degeneration of a downstream neuronal system, the brain, in response to a decrease in stimulation from an upstream neuronal system, from the subluxated spine. Now here's my summation of everything I've talked about so far. Just one paragraph that kind of says it all. Subluxations cause decreased firing of mechanoreceptors to the brain. I should say mechanoreception to the brain. Neurons in the brain die if they are deprived of neurologic stimulation. And one of the few types of receptors that provide constant neurological input to the brain are from the mechanoreceptors in and around the spine, the spinal column, and rib cage. So just one more comment from Silver. He says subluxations disrupt input into the brain. The brain is relying on that constant input on those pathways. Less normal vertebral motion equals less firing into the brain. So the central integrated state of that nuclei drops, and transneural degeneration is the end product, brain cell death. I think you got that. I pounded it in there, but very important. Switching gears a little bit here, we're going to talk about these mechanoreceptors and nociceptors. It's kind of interesting. Yesterday, I asked the surgeon, and he was going to talk about discs, and so I was in the room before that. I asked him, I said, I'm doing this presentation tomorrow, and nociceptors, they are not in the inner 2/3 of the intervertebral disc. They do grow into the disc as a disc becomes degenerated and cracks and fissures and all that. And I said, what about mechanoreceptors? And he said, that's a really good question. I don't know. I thought that was kind of interesting from an orthopedic surgeon, but I did look it up, and as it turns out, it's kind of the same way with mechanoreceptors. They're not in the inner 2/3 of the disc, in the healthy disc. Ruffinian fibers are in the anterior longitudinal ligament and the outer disc, but not in the inner disc. So every joint in your body is innervated with mechanoreceptors and nociceptors. Nociceptors comprise about 80%. Mechanoreceptors only about 20%. Mechanoreceptors are stimulated by normal joint motion and normal alignment. Nociceptors are not. Nociceptors are stimulated by noxious stimuli. Mechanoreceptive input into the central nervous system needs to be constant and is considered a vital and necessary nutrient for optimum brain health. And now, this is the only thing I'm going to say about proprioception and proprioceptors, is that proprioception is carried by mechanoreceptors. But the term proprioceptors is not used anymore in newer textbooks because they feel like there are no receptors that carry strictly proprioception. Now, the reason I tell you that is if you start reading some of these research articles, if they use the term proprioceptor, like chiropractor, it's probably an old textbook. And you might want to get to a newer textbook. A little bit more information about mechanoreceptors and nociceptors. Mechanoreceptors are located in joints, muscles, fascia, bone. They're called such things as muscle spindles, Golgi tendon organs, joint capture receptors, and then these interstitial receptors. Nociceptors are located essentially everywhere except the healthy nucleus pulposus, and the inner 2/3 of the annulus, and the articular cartilage of zygapophyseal joints. So they're not in the facet joints. Interesting. So this is a slide I just developed, and I call it the battle of joint pain and brain health. And once again, remember that